going to get started in a few minutes. We're just waiting to let people in. Good afternoon, everyone. Good afternoon, everyone. Welcome to the Chi Omicron Omega chapter of Alpha Kappa Alpha Sorority Incorporated's Pink Goes Red Virtual Work and Search Heart Health Summit. I'm Nicole Plenty, Chair of Target 2 Healthcare and Wellness Committee. We are really excited that each of you are here with us today. But before we get started, let's take some time to take care of some general housekeeping rules. So please keep your computers and cell phones muted by making sure that little red slash is over your microphone at the bottom of your screen. At the end of each presenter, if time permits, you would like to ask questions, then you can unmute yourself and speak your question aloud. Alternatively, the committee members will be monitoring the Zoom and Facebook live chats. So if questions come to your mind during the session, please place it in the chat and we will try our best to ask that question aloud if time permits. The Heart Health Summit will last approximately 2 hours. So if you have to take a break and step away, we understand that. Just make sure your camera is off and that you are muted when doing so. We are excited about the event today. You'll learn lots of information about heart health and have several times to win awesome prizes. Please make sure you're wearing comfortable shoes and clothing. Now I'll hand it over to Jeanette Smith, Target 2 Healthcare and Wellness Committee Co-Chair.
Well, good afternoon. We are so glad to have each of you here today to discuss heart health disease. I want to pause for a minute and have everyone point to themselves. By the looks of things, everyone is pointing to their heart. So by taking care of your heart, ultimately, you're taking care of you. The purpose of Pink Goes Red and this event is to bring awareness to heart disease and encourage lifestyle changes to reduce the risk of heart disease amongst women. More than 40% of Black women have heart disease, and unfortunately, many of us don't even know it. To help us understand more, we have a fantastic lineup of experts who will help us understand the importance of heart disease prevention and steps we can take to prevent long-term complications of the disease. Nicole, back to you.
To help us really break down what heart disease really is and how it affects us as Black women, we have a very special guest, Dr. George Adeshino. Dr. Adeshino was born and raised in Houston, Texas, and is the first generation Nigerian American. He obtained a Bachelor of Science from the Xavier University of Louisiana, followed by a Master of Science in Public Health from Tulane University. He obtained his medical doctorate from UTMB. He then completed a residency in internal medicine, followed by a cardiology fellowship at Baylor University Medical Center, Dallas, where he was both chief resident and chief fellow. He now practices cardiology full-time at Kelsey-Seybold Clinic and also hosts the COVID Conversations Instagram Live series. He is a proud member of Alpha Phi Alpha Fraternity Incorporated. He's married and has 2 adorable kids. Dr. Adeshino, thank you so much for being here.
Thank you so much for having me. Can y'all hear me okay?
Yes.
Good. My name is Dr. George Adeshino. Like Dr. Plenty said, I am an adult general cardiologist and I work for Kelsey-Seybold Clinic. I live, breathe, and love everything about cardiology, but I am very passionate about engaging as well as educating our community. So it is a complete honor to be here. So with that, let's dive right on in. Can I get the next slide, please? So I think traditionally everyone can agree that heart disease has kind of been connotated with it being a man's disease. So if you look at movies, literature, TV shows, it's usually a middle-aged or older man that's having a heart attack. And even if you look now, this is literally just from Google Images that I did late, this week. 90% of the 20 images that pop up are all men. There's only 2 images that show female and only 1 picture here that's showing a woman of color. Next slide, please. But if we look at the statistics, it's a really big reality check. So heart disease is actually the #1 killer for both men and women across the board. And, I think when you think about a chronic disease or the #1 disease that might affect women, most people think of breast cancer. And that's because we as a medical community have done an excellent job of educating, raising awareness of breast cancer, how to spot it, how to treat it, but we're not really doing that well when it comes to heart disease in women. So if you look at the stats, again, this is a really big reality check. So if we look at deaths attributed to women, about 1 in 31 is due to breast cancer, whereas 1 in 3 is due to heart disease. And if you break that down even further, we're losing about 50,000 African-American women to heart disease every year. So that's 50,000 of our mothers, our daughters, our wives, our sisters to a preventable disease. So it's really important. We really need to change our mindset of how this affects women. The American the American Heart Association actually did a pretty interesting survey looking at African-American women. And they found that African-American women above the age of 20, heart disease was present about 49%, but only 1 in 5 really believed that they were actually personally at risk for heart disease. Only 58% were aware of the signs of heart attacks, and then only 36% actually knew that heart disease was probably their greatest health risk. So again, with the education and the awareness that we have done with breast cancer, we really need to change our mindset because this is affecting women every day. Next slide, please. So why are we at risk and how are we at risk? So it's really important to look at the risk factors for heart disease. We can kind of break it up into 2 groups. There's the things that we can't control, and there's the things that we can control, which is kind of known as our modifiable risk factors. So things we can't control, those are the things we're born with, right? So our age, our gender, our family history, our race, and whether you've had a previous heart attack. But then if we look at the things we can control, these are the things that as a cardiologist, I'm gonna be looking at every single time I see my patients, because these things, if I can help to control them or ideally help to prevent them from even occurring, can drastically decrease the chances of you developing heart disease. And these include things like your blood pressure, your cholesterol levels, whether you have diabetes, whether you smoke or not, your activity level, as well as your weight. Next slide, please. So if we break it down a little bit further to look at our community specifically, we know across the board, there are racial and ethnic disparities all across the board in medicine. So this is actually an interesting survey that was conducted, I believe in 2015 by the National Health and Nutrition Examination Board. And they looked at African-Americans as well as our cohorts, including whites, Hispanics, and Asians. And they broke them down looking at different risk factors. So if you see that picture on the left, hypertension, also known as high blood pressure, during that survey, almost 42% of African-Americans had high blood pressure. That's almost half. So almost half of the people they surveyed at that time, African-Americans had blood pressure. And you can look at the numbers across the board. That's quite significantly higher when we're looking at our counterparts. Looking at obesity, we were also, African-Americans as well as Hispanics were pretty high, being about 47.5%. Next slide, please. looking at diabetes, and that's really important because diabetes is actually what we call a coronary artery equivalent. So the chances of you having coronary artery disease go significantly, they're significantly elevated if the presence of diabetes is there. And so again, Hispanics were actually a little bit more than African Americans, but we are definitely a close second. And then surprisingly, looking at high cholesterol, it was fairly even across the board. So looking at these risk factors, we have a higher proportion of our communities having these risk factors, which is going to increase our chances of having heart disease. Next slide, please. Now, heart disease has many forms, right? So it's more kind of an umbrella term of any disease that might affect the heart or the vasculature associated with it. But we can break it down into further forms, including coronary artery disease, congestive heart failure, arrhythmias, as well as valvular diseases. Next slide, please. But when most people think about heart disease, we think of coronary artery disease, this is what's causing heart attacks. So I kind of want to dive in a little bit more deeper into this specifically, okay? So if you look at, the heart, its function is to pump, oxygen-rich blood to all of your organs. But the heart actually has its own blood vessels that delivers oxygen-rich blood to the muscle, right? And so this helps the heart function correctly and keeps it healthy. So if you look at the pictures on the right, that top picture, imagine you have a straw and you paste it down on your cutting board and you're cutting it in little pieces and you're looking down right at the middle of it. That's what a healthy coronary artery should look like. As you can see, there's no blockages on the inside. It's nice and healthy, and it's equipped to deliver blood flow to the heart muscle. Now, when we have extra fat that's circulating in the body and in the bloodstream, that fat can get deposited in the walls of these heart arteries, and it can form and deposit what we call plaques. So if you look at that picture on the right in the middle, that's a diseased coronary artery. So you can see that opening has already narrowed down, so it's shrinking. So not as much blood flow is getting to that heart muscle, or as we call it, the myocardium. And then if you look at the bottom of that artery, you see all that gunk and junk that's developing. That's from high fat and high cholesterol that's depositing. Now, this plaque can grow and get bigger and bigger and eventually completely block that opening. But the way you have a heart attack is that plaque there, that little circle that you're seeing at the bottom of that picture, it can rupture. And when that thing ruptures, it kind of triggers an inflammatory cascade, and our body responds to it by forming a clot. So you can see that bottom picture to the right, that's after the plaque has eroded, and that red big chunk there, that's a blood clot. And that's our body trying to contain this kind of inflammatory foreign substances. When that happens, it completely blocks the heart artery, and that is what causes a heart attack. So I want everyone to keep this picture in your mind when we're talking about heart attacks, and you can really see the evolution of the healthy artery on the top, the disease vulnerable artery in the middle, and then the heart that's having a heart attack at the very bottom. Next slide, please. So even though this process is similar in men and women, there are structural and functional differences when you're comparing the heart of a man versus a woman. And sometimes we think that these differences might be why the presentation of the disease might be a little bit different. So let's just go through some of these differences briefly. So if we look at a man's heart versus a woman's heart usually is quite a bit smaller than a man's. If we look at the heart, that picture on the right-hand side, it's comprised of 4 heart chambers. So there's 2 small ones on the top and then 2 large ones at the bottom. Ideally for a woman's heart, usually those chambers are quite a bit smaller as well. In addition to the heart muscle that's separating those chambers, that's actually a little bit more thinner in a female's heart as well. A woman's heart actually pumps faster than a man's heart, but it ejects about 10% less blood with each squeeze. So it's actually working a little bit harder. The woman's heart is actually working a little bit harder compared to a man. Our hearts actually respond differently to physiologic and as well as emotional stress as well. So when a woman gets stressed out, usually her pulse rate increases and she tries to compensate with that stress by ejecting more blood flow. Whereas when a man gets stressed out, the arteries of the heart usually constrict and clamp down and increase his blood pressure. So again, the process of a heart attack is the same in both men and women, but these differences might be why we see some differences in regards to symptoms as well as outcomes when it comes to heart diseases. Next slide, please. So I think stereotypically we all know this, or let me backtrack. Most people think they know the signs of a heart attack, but those are usually the stereotypical signs of a man. And again, you can see this in movies and TV shows. It's usually a man clutching his chest, pain that's right in the middle that might radiate down to his arm, have some left arm numbness, and be severe enough for him to pass out, women usually present quite a bit differently. And usually the symptoms are more subtly. In fact, some women don't even have chest pain at all. They can have pain in their jaw, in their neck, sometimes in the middle of their back, like in between their shoulder blades. And even sometimes I've seen it where it's mainly kind of upper abdominal pain. It can be associated with nausea and vomiting, shortness of breath, fainting, indigestion. And one of the biggest things, you know, I always ask my female patients, like, what was one of the key indicators that you knew something was different? And they all seem to say that they started feeling extremely fatigued in like the days leading up to it. But if you look at all those symptoms, one could easily rationalize these kind of mild symptoms for being something else. And so a lot of the times women tend to not get diagnosed right away, and there's a delay in treatment as well. Now, like I said before, the heart muscle is called myocardium, and we all know the saying, you know, time is money. In cardiology, time is myocardium. So the longer the heart goes unhealthy, that decreased blood flow, that can increase the chances of that heart muscle becoming more diseased and, you know, having complications from heart disease, including heart failure and unfortunately even death as well. Next slide, please. So not only is it harder to diagnose heart disease with just looking at signs and symptoms, sometimes it's actually even harder when we have objective evidence as well. So this picture on the right is what we call an angiogram. And this is how we look for heart blockages. We put a catheter either through the artery of your wrist or through your groin, and we thread it all the way up to the heart, and we shoot contrast into your arteries. And essentially we take a fancy x-ray that kind of spits out this picture here. Now, everyone's heart has 3 major arteries, 1 on the right and then 2 on the left. So kind of think of those major arteries being like highways, and then they branch off into smaller arteries, which then branch off into smaller arteries, so forth and so forth. So if the big arteries are the highways, the small arteries are like the feeder roads. Most of the time, men will have blockages and heart attacks that are affecting those main arteries. So you can see those big arteries there. That's pretty easy to spot if there's a blockage. Whereas with women, we usually see that sometimes you can have heart blockages in those smaller arteries. So that makes it harder to identify, and it's actually harder to treat as well too. Women often require a longer hospital stay. Again, I think a lot of that is associated with a delay of diagnoses, and they're actually at a higher risk to die in the hospital before they're discharged. There's a set of medications that we usually give after a heart attack, and scientifically, these medications can help you feel better, help you live longer without having a heart attack, and hopefully, you know, prevent you from having another heart attack as well. But studies have shown that women tend to get discharged from the hospital and they're not even given the appropriate or proper medication. So this makes women a higher risk or a higher risk of having a heart attack within the first year of them having a heart attack. So it's really important to know the signs, to know the symptoms, and especially being African-American females, to be able to be an advocate for your healthcare. Next slide, please. So on top of that, there's also some hormonal differences that actually make women a little bit more prone as well too. So there's been studies that show that estrogen is actually cardioprotective. So essentially estrogen, or natural estrogen, has a very positive effect on the blood vessels. It keeps those blood vessels nice and flexible and decreases the chances of there being any atherosclerosis or any hardening or damaging of those arteries. So if we remember that picture that I showed before, it helps keep those arteries nice and plump and nice and not obstructed. Estrogen actually affects your cholesterol as well. It keeps your good cholesterol, your HDL high, and your bad cholesterol down. But we've seen that after menopause, when those estrogen levels drop down, those triglycerides tend to increase, as well as the bad cholesterol, and the good cholesterol drops some as well. So those two things make sense because we usually see women mainly having heart disease perimenopausal or postmenopausal. So usually around the age 65 and above. Men, we can see anywhere from like 40, 45, middle age. But with women, we tend to see it later on in life. And that makes sense because that estrogen level is cardioprotective. There have been multiple studies seeing if hormone replacement therapy gives some heart protection. Those studies have had many mixed results. And I'm sure Dr. Plenty can attest, there's a lot of OB-GYN side effects that go along with it. So at this time, there's no real hardcore recommendation for hormone replacement therapy specifically to protect your heart. But we do know that that natural estrogen that is pumping in your blood flow before menopause definitely protects your heart. it actually has a direct correlation with your heart rate as well. We see that post-menopause, that in those lower estrogen levels tend to increase your heart rate and actually predispose you from having palpitations as well. So that's something common that we see a lot in clinic. Next slide, please. So now that we know about what the disease is and how we can spot it, how do we prevent it, which is something that I'm very passionate about. And I think more of us in the medical community need to get on board. It's not about necessarily just treating the disease. My job should also be helping you to prevent from even getting this disease. So the next slide, please. So I will say, even though I'm a physician, I do not like going to the doctor, but I know it's a necessary thing. So the way I think about it is, you buy a nice car, you got a Lexus, a Mercedes, or whatever you're driving, that you want it to be dependable and get you to where you're going. And you want to know if you get in the car and turn it on, that car is going to work, right? That should be the same thing with your body. Just like you take your car to get maintenance at the dealership, you got to get your butt into the doctor and get maintenance for your body as well, too. And so these are kind of key indicators that give us a snapshot into how well your body is functioning and allow me as your cardiologist to figure out what things can we tweak either with lifestyle modification or medications to help get these things under control. So the first thing is looking at your blood pressure. So a good ideal textbook blood pressure is 120/80. And blood pressure is one of the things that I really try to harp on because as you saw on that slide, almost 42% of us have high blood pressure, but unfortunately, only 27% of us actually have well-controlled blood pressure. And what usually happens is this blood pressure starts to kind of go up slowly as we get older, as we get more out of shape, and our bodies start to accommodate for these high blood pressure values. So we don't feel anything. We feel perfectly fine. I can't tell you how many times I've had people come in my office with blood pressures up to 200 and they're walking, coming in, smiling, feeling perfectly fine. It's because their bodies are used to it. And, they call it a silent killer, for a reason, because exposing your organs, your arteries, to these elevated pressures, it does chronic micro damage over time. And if you have damage of the arteries in the brain, you can have a stroke. In your eyes, it can lead to blindness. Of course, in the heart can cause heart disease. And then in your kidneys, it can actually cause kidney failure and cause you to actually be dependent on dialysis. So if you go in any dialysis unit, you'll see most of those patients, they look like us. They're African-American or they're people of color because we have a very, very high predisposition to uncontrolled blood pressure. So it's really important to either monitor your blood pressure at home, but definitely make sure you're monitoring it at your doctor's office as well. Knowing your cholesterol. So again, with estrogen, there is some cardio protection with that, but we just still want to make sure that your total cholesterol is staying below 200, your good cholesterol staying above 40, and your bad cholesterol around 100 if possible. Also knowing your fasting blood sugar. So whenever someone has diabetes, the chances of you having, having heart disease goes up drastically. So we also want to make sure your blood sugar looks great, checking your A1C as well. And then making sure we're keeping your weight in control. So looking at your BMI, which is your body mass index, making sure that you're keeping your body at an ideal weight. Over 25 is considered overweight, and then over 30 is considered obese. Next slide, please. Excuse me. I don't have COVID, y'all, I promise. I just got tested recently. So I got to throw that out there now. Also, now tobacco. I was very excited to see that you guys are having a whole section just on tobacco use. This is probably one of the bugaboo things that I bug my patients about every single time I see them, because tobacco abuse accounts for almost close to 500,000 deaths per year. Just smoking alone triples your risk of heart disease. And even if you're not a smoker, even if you're just a secondhand smoker, which we see a lot in women, where they're not necessarily smoking, but their spouse or their significant other is, that actually increases your risk by 20 to 25% as well. So when we see a smoker who quits, your risk of death from heart disease already starts to drop drastically immediately. But if you kind of track this over about 10 years or so, that risk actually drops down closer to someone who has never smoked at all. So I know it's really hard, tobacco is definitely addicting, but the sooner you stop smoking, the better, and your heart will definitely thank you. It won't necessarily to completely reverse the damage that was done, but it'll at least stop the progression and hopefully prevent you from having any further damage. Next slide, please. Also, healthy eating. Again, I know there's going to be a whole section on here, so I won't spend too much time, but I think it's important to know there are so many fad diets and all of this promise to, drop 30 50 pounds really quickly. I think it's important to find what works best for you, make small choices that you can do every day and just incorporate it into your general lifestyle, especially watching our salt intake. We as African Americans and people of color, we are genetically ingrained to hold on to salt. And I think a lot of people think, if I'm not eating fast food, I'm going out to nice healthy restaurants. Trust and believe those nice healthy restaurants, they're gonna want to make sure their food is nice and seasoned. It's still salty. So you got to really make sure that you're reducing your salt intake and ideally try to stay below 2 grams if possible per day. Next slide, please. And last but not least, we got to make sure that we're exercising regularly. Every time I have an older patient in their 90s or their 100s and they look 40, especially if they're African American, I always ask them, like, what is the key to your longevity? And they all say it's exercising and mobility. So I know we all live busy lifestyles. The way adulting is set up in this modern world, it's conducive for all of us to be sedentary. But every day we need to fight against that and get up and keep moving. The American Heart Association actually recommends that you get about 150 minutes of moderate exercise per week, or 75 minutes of vigorous exercise. So again, you don't have to go out and train for a marathon. Find what you like to do. Find what's something that you can stay consistent with and incorporate it into your lifestyle. That is going to be the key to longevity. Next slide, please. Well, I think that is all that I have. I hope I didn't go over my time. Again, I hope that I was able to give you guys some tips to kind of help you live the healthiest lifestyle as possible. I hope none of you need a cardiologist, but if you do, I hope to help you at some way, and my information is here. And I guess we can pause if there's any questions.
Hello, we do have a question here.
Yes,
Does
ma'am.
smoking cigars fall into the same category as cigarettes?
Yes, ma'am. Unfortunately, all tobacco. The only kind of category or subset that we're not really sure about right now is vaping. Vaping is relatively new, so there's not a lot of studies on how it affects your heart. We do know that it's horrible for your lungs. So essentially it can cause liquefaction damage to your lungs. But in regards to a heart standpoint, we don't really know how vaping affects the heart, but any tobacco use, hookah, cigarettes, cigar, all of those things are going to be bad for your arteries and cause atherosclerosis.
Okay, we have another question. Do you suggest Chantix or any form of prescription medications for someone who wants to stop smoking?
Yes, ma'am. And again, I think there's going to be a section on this, so I won't talk too long on it. But of course, ideally, if you can quit cold turkey, that's great. But given that it's ingrained in your daily lives, and of course, it's addicting, I think Nicorette gum is great. The patch is great. I usually tell patients to try those things first. If nothing is working, then Chantix is a great tool. You definitely want to make sure that you're talking to your primary care provider about that, because of course, with any medication, there are side effects. Sometimes it can affect your mood. It can give you bad dreams. So you want to make sure that you're being under the care of a physician so that we can check for all of those things as well. But yes, in those cases where nothing is working, it is an excellent tool and it would definitely help you stop smoking for sure.
Okay, we have a few more questions and we also have some in the chat. What is recommended to minimize heart disease in women that go into menopause early and are not on hormone replacement therapy to keep the estrogen normal?
So right now, again, there is nothing, and I'm sure Dr. Plenty can definitely help me out with this as well. There's a lot of reproductive issues that can occur with hormone replacement therapy. So initially, traditionally, I mean, they were putting everyone on it because again, it would help with menopausal symptoms and we thought that it would help with the heart. But looking at these long-term longitudinal studies, looking at these large studies, there really hasn't been any long-term protection from a heart standpoint. So unfortunately, it's about looking at those risk factors that we talked about, looking at the things that you can control, like your blood pressure, like your cholesterol, minimizing those risk factors, and then of course, staying under the care of a physician, that will help to decrease your risk as well.
Okay. All right, another question. What are your thoughts on BMI being an accurate indicator for women of color?
And I'm glad someone brought that up because I was actually supposed to talk about that. I actually think for women of color, it is a little problematic. I think one of the famous kind of examples is looking at Serena Williams. So she went to a doctor and, you know, she's not that tall, but she is all muscle, right? So they looked at her weight and they looked at her height and they called her obese, when
Mhm.
clearly she is probably one of the fittest people on this world.
Yeah.
So there's another thing that you can look at. It's called a hip to waist ratio. And that's, I think, is a little bit better, especially for women of color, especially if you're more curvy, because what we really want to see is how obesity affects your risk. It's really your abdominal area. That's the bad fat that increases your risk of diabetes and high blood pressure. And so looking at the hip to waist ratio might be a little bit better for people of color. Unfortunately, it's not a common practice. So like if you go to your medical records, it's not even always necessarily even measured. So that's something, again, being an advocate for yourself, and you can talk to your doctor about that, and we can make sure we include that in your risk profile as well.
Okay, as of now, that's all the questions that we have. I can look real quick in the chat. Here's one. If my yearly physical blood work is normal, what are your thoughts on obtaining a heart and blood pressure monitor?
So I usually say anybody over the age of 40, I think it's a fairly good idea to have a blood pressure machine at home, because if you go to the doctor just once a year, that's just a snapshot of what's going on that day. I think it's a little bit more reliable to see what's going on at home, maybe a couple of times per week, and have an overall trend, and that kind of gives us a better idea. And it will help you to kind of catch your blood pressure. If it starts to kind of slowly rise, we can nip it in the bud fairly early, again, whether it's with lifestyle modification and or medications if needed. But I think monitoring it at home, anyone above the age of 40, I think is a great idea. And then anyone who has a family history, I would definitely recommend doing that, because again, you're going to be at a little bit of a higher risk in regards to developing it later on in life.
Okay, we have one more question here. How can we decrease the odds of heart disease when you have a family history of it?
I think one, just knowing your family history, that's a great place to start. Unfortunately, we as people of color, especially African Americans, we don't talk about our family history much. It's kind of sometimes considered taboo. And I mean, I'm a full-blown cardiologist, and I don't even know half of my family history. I've had to pin my parents down to kind of get that background, because it's just something that we don't grow up necessarily talking about. So I think knowing about your family history is the first step. Again, making sure that you're watching your numbers, knowing your numbers, and then just doing anything that you can to decrease your risk.
Great. Okay, so it looks like we have a few more questions in the chat, but we need to move on. So if maybe at the end, if time permits, we can go back to those.
Sure. And anyone who has any additional questions, my Instagram is listed there. If you want to DM me a question or anything, any concerns, and I can also help with that as well.
Thank you so much.
No problem. Thank you guys for having me again.
Thanks so very much for presenting, Dr. Adeshino. Okay, our next speaker is Ms. Onique Hennigan. Okay, Onique Hennigan, MA, is a senior community health educator at the University of Texas MD Anderson Cancer Center. She provides cancer prevention education programs in the greater Houston area. Ms. Hennigan has a master's degree in psychology from the University of Houston, Clear Lake, and is a certified tobacco treatment specialist. Ms. Hennigan, thank you for being here.
Thank you for having me. If you'll, I will go ahead and share my screen, but I am excited to be here to talk about this. Now, I apologize, some of the information that I'm going to go over has already been addressed, but I want to make sure I give you guys a full picture. And so I will try not to go over my time. But again, if you have questions, go ahead and put those into the chat and I will answer them at the end if time permits. So I don't know if you guys know, it was touched on a bit, but tobacco use is the single most important thing that you can do to stay healthy. And tobacco use is the most preventable cause of disease, disability, and death in the United States. One of the best things you can do to avoid these is to not use these products. And it was mentioned also about cigars. I'm going to go over that, but I just want to reiterate and say that all forms of tobacco are dangerous. There is not one safe form of tobacco. And so I want to make sure you guys have all the information when we leave. Just know tobacco use causes more deaths than car accidents, alcohol, drug abuse, suicides, homicides, and AIDS combined. It kills a lot of people. It may not do it overnight. For some people, it takes a while, but it kills a lot of people. And so I'm going to touch on the different types of tobacco products because I want to address some of the misconceptions that people have around some of them. Like I said, there's no safe form, but different types of tobacco products includes the types that are smoked, like cigarettes, cigars, cigarillos, BDs, hookah, pipes. They're all dangerous for you. They all can lead to different cancers and other diseases in the body. They put thousands of chemicals in your body that are not supposed to be there. With cigars, a lot of people will say, oh, I don't inhale, so I'm fine. And that's not true. Cigars are actually tobacco, some chemicals wrapped in a tobacco leaf. And so they contain 3 times as much nicotine, which is addictive, as a regular cigarette. But in addition to that, when you're breathing them into your mouth and into your body, even if you don't think you're inhaling into your lungs, you're still putting them into your mouth. Nicotine and all of those other chemicals get absorbed through the lining of the mouth. And so you are still at risk for various types of cancers, lung disease, as well as heart disease. All right. And hookahs, a lot of young adults, especially African Americans, I see hookah bars popping up all over the place, especially here in Houston. They think that it's something fun to do in social settings. Hookah is not good for you. 1 hour of hookah is equivalent to smoking 100 cigarettes. It exposes your body to a lot of toxins that we know do damage in the body. And not only are you exposed to the dangers and the toxins from tobacco, you're also exposed to the toxins from the charcoal that's used to heat that hookah. And so it is dangerous for you, all right? Like I said, there's not one safe form of tobacco. Smokeless tobacco products and dissolvable tobacco products. Some people think because you're not lighting them that it's safer for you, and that's absolutely not true. Like I said, you are still exposing your body to different types of chemicals, a lot of chemicals that do damage in the body. All of them have nicotine, which makes them addictive, and all of them can increase your blood pressure, your heart rate, your risk for heart disease and cancers. Vaping and IQOS, those are the electronic nicotine delivery systems. They're not safe for you either. True, they are a lot newer on the market, and so there is still a lot of research that needs to be done on them, but we know that they are not safe for you. IQOS is a little bit different. It's more of a tobacco heating system versus vaping, which heats up a liquid nicotine into an aerosol. And so they operate a little bit different, but the main point is they are dangerous tobacco products for you. They're not safe for you. So what exactly happens in the body if you are using these products? We know that you can increase your risk for cancers, and I'm going to talk a bit more about cancers in just a moment. You increase your risk for heart disease. Cardiovascular disease accounts for about 800,000 deaths in the United States every year, and 20% of those are due directly to using tobacco products. Smoking can damage your blood vessels. It can lead to coronary heart disease, high blood pressure, heart attacks, aneurysms, arteriosclerosis, which increases your risk for strokes as well. And so smoking does a lot of damage in your body. It also increases your risk for various lung diseases like emphysema and asthma, increased asthma attacks, low birth weight in young ladies that are having babies. Your babies may be born at a lower birth weight, making it harder for them to survive and to be healthy. And diabetes. Smoking can not only lead to diabetes, but if you already have diabetes, it can increase the complications you have from diabetes. It can also increase your risk for kidney diseases, amputations, eye diseases, blindness, nerve damage. A host of things can happen in the body as a result of using tobacco products. So again, there is no safe tobacco product, and it does a lot of damage in your body. I did want to switch back to electronic cigarettes because there are so many young adults that are using them and they don't necessarily know how damaging or dangerous they are. But, electronic cigarettes are not safe for you either. Even though we're still learning about them, they do a lot of damage in the body. They go by many different names. Some people call them electronic cigarettes, e-cigs, e-hookahs, e-mods, vape pens, water vapes, tank systems. Doesn't matter what you call them. They're all battery operated devices that heat up a liquid nicotine into an aerosol. And that liquid, that e-liquid, that liquid nicotine and other chemicals is so dangerous when it gets into your body. It can scar the lining of your lungs, increase the irritation in the lungs. It is very dangerous. And most electronic cigarettes contain nicotine, meaning that they are addictive. And so a lot of young adults are using them, they're getting addicted to them, and they're exposing their body to a lot of damaging chemicals, right? So we're going to move on. Some things that we do know about vaping is that they can also increase your risk for a lot of the same things that regular smoking cigarettes can do, like mouth and throat irritation, increased asthma attacks, chest pains. They have been identified with elevating your blood pressure and raising your heart rate, upsetting your stomach, as well as nausea. And it can damage parts of the brain that control attention, learning, mood, as well as impulse control. So again, there is no safe tobacco product, and that includes hookah and vaping. Some other health effects that I do want to talk about and that were mentioned a few moments ago are the effects of secondhand smoke. Secondhand smoke is extremely dangerous for you also. There is no safe amount that you can be around. It has health effects, negative health effects, like it can increase your risk for asthma attacks and various breathing problems. It can increase your risk for lung cancer, heart disease, ear infections, and even death. A lot of people die from being around someone's secondhand smoke. And so you want to make sure that you are putting yourself in situations where you're not exposing your body to that. We do know that about 50,000 non-smokers die every year from the effects of secondhand smoke, right? There is no safe amount of it. All right, and then I would also want to make sure we touch on cancers. Like I said, cancer is directly linked to tobacco use. We know that tobacco use is the leading preventable cause of cancer and cancer deaths. 30% of all deaths are attributed from cancer are attributed to tobacco use. And 80% of all lung cancer cases are attributed to someone's tobacco use. There are other cancers that are associated with using tobacco products, like cancers of the cervix, the mouth, the throat, the esophagus, your pancreas, your kidney, your bladder, your stomach, your nose and sinus cavities. You increase your risk of many types of cancers if you are using these tobacco products. And so again, we want to reiterate that if you are thinking about quitting, if you know someone that uses tobacco products, encourage them to quit. And there are some things that you can do to help quit. One, you want to get the facts. I've given you a little bit of information. You know that smoking and using these products is dangerous for you, but talk to your healthcare provider. Do some research. You can look on the internet, you can go to local library systems, learn more about what options there are available, right? And you can set a quit date. Once you set a quit date, get some support, get family and friends involved, figure out how you are going to go about your quit attempt, meaning set a plan. So if you're going to use nicotine replacement therapy, that's the patch, the gum, the lozenge, those are great places to start. You want to make sure you have those on hand. If you want to use a medication or you think that may be an option for you, talk to your doctor. Chantix is a great option if it's a good fit for you, but that's something you and your doctor have to discuss. There are also other medications you can be prescribed, like Wellbutrin or bupropion, that can be beneficial at helping you to quit. But again, those medications come with side effects, and so you have to be a good fit for them. So you're going to want to talk to your doctor. There are support groups that are available. I'm going to tell you about other different things, different types of support that you can look for, resources in just a moment. But you know, it's a big step and it is not easy because nicotine is extremely addictive. So just know that for most people to be successful at quitting their tobacco habit, it takes between 8 and 11 serious quit attempts. That's a lot, and it can be discouraging, but don't get discouraged. Don't give up. Keep trying to quit, especially now because we're still in a pandemic. And so if you are using tobacco products, whether that's vaping, hookah, cigars, you are damaging your lungs. And COVID-19 is a respiratory illness, right? It attacks the lungs. And so quitting tobacco is one of the best things you can do for your body, especially now. It can improve the health of your lungs, your heart, and your immune system. All right, so some resources to help you stop smoking. MD Anderson offers tobacco cessation research studies, and you can get more information at the number on the screen. You can also look us up online at www.mdanderson.org/prevention study. Know that in Texas, we have a quit line. The quit line number is 877-YES-QUIT. You can also Google the Texas State Quit Line and it'll pull up the number. You can get free telephone counseling. They do counseling web-based as well. And if you are eligible, you may be able to get free nicotine replacement therapy through the Texas State Quit Line. I also failed to mention that at MD Anderson, our research studies, we provide medications as well, and they are all free, as well as tobacco cessation counseling. That is free also. Some other things we want to do in relation to tobacco use, you want to protect your kids. There are various things you can do before in particular that are very important. If you use tobacco products, stop smoking around your kids. You want to quit, don't use it in their presence, and don't let other people smoke around your kids. Children whose parents smoke at home are hospitalized more often during their first year of life for bronchitis and pneumonia than children of non-smokers. So you want to make your home a smoke-free home. Don't allow anyone to use these products in your car as well. When you are out and about, you want to seek out places that don't allow smoking so that you can reduce the amount of secondhand smoke that they're exposed to. We know that non-smokers exposed to secondhand smoke, they increase their risk of developing heart disease by 25 to 30% and lung cancer by 20 to 30%. And we know that nearly 9 out of 10 current adult smokers, they started smoking before they were 18 years old. So your kids tend to do what they see you do. And so you want to make sure that you are putting forth good images for them by not using these products. Talk to your kids about tobacco use. Talk to your kids about vaping. Talk to your kids about hookah use. They are dangerous products. And so you want to be the one to give them these messages that they are dangerous for them. And so they will believe you, they will listen to you, but you do want to talk to them about saying no and about staying away from people that use these products, right? If you have a young adult in your life, a child, a niece or nephew that is vaping and they want to quit, there are some resources available to you. This is Quitting. Offers a free program to help our teens quit. If you're a parent of a young vapor, you can text QUIT to the number on your screen, 202-899-7550, and you can receive tips and advice on helping them to quit. There's also a direct number that they can call, but you can get that information from them. So we do want to talk to our kids and we do want to help them as well. All right, so we offer a host of different cancer prevention presentations. If you are interested in those, please don't hesitate to let me know. Let me pull up my contact information. And while I'm doing that, if you have questions, we can go ahead and start getting those questions.
Okay, wow, that was some great information. We had a lot of questions that came through. You did answer most of them.
Okay.
If you do have a question, please put your question in the chat. We may overlook a raised hand, so put your question in the chat. So there was one question that maybe you can go in a little more detail on that you mentioned very quickly. As an educator, what is a strong talking point to share with adolescents on smoking marijuana? Most of them think it is not harmful.
Yes, we know we are learning. You know, it wasn't a lot of research done on the dangers of marijuana because it's been classified as illegal. But now that more and more states are legalizing it, we're getting more information. We already know that it's addictive. A lot of young adults will say, oh, you can't get addicted to using that product. You can get dependent on it. You can get addicted to it. And so we want to talk to our kids about, you know, protecting the health of their brain. Using these products damages your brain. And so there's still a lot of research that needs to be done, but I would just, you know, point to the fact that you're not supposed to be smoking anything, especially for lung health. Our lungs are designed to filter out the air that we breathe, not designed to filter out tobacco use, not designed to filter out marijuana use. They were not designed for that. And so you want to have the healthiest body possible. You want to only do things that, you know, that are healthy for us. And that includes not smoking anything. Like it's not safe for you at all.
Okay. Just for matter of time, we'll make this one our last question. Are there any teen support groups? that you know of?
Teen support groups, well, you can do a Google search of that, but yeah, like I said, This Is Quitting offers individual support for teens. It's text-based, so they can do it anonymously. You can look that up. We have information on that in Texas. If you shoot me an email, I can get that information to you as well. But there are various support groups. There are groups and clubs at different schools. So talk to your kids about some of the available options that are in their own schools. There are supports at church. I know a lot of churches have started, different things to help with mental health and to help with substance abuse. And so tobacco is one of those. If you go to church, talk to members of your church. But I would say talk to your kids, talk to them a lot, and then you can do a little bit more research online to get some of those support groups.
Well, thank you very much. That is our last question that we have for you right now. But thank you for the information. I'll hand it off to Raquel at this time.
Hello, everyone. For those of you who don't know me, I'm Raquel Garrett. I serve as the president of Chi Omicron Omega chapter. I want to take this time to thank everyone for attending. As you know, Pink Goes Red is one of Alpha Kappa Alpha's 7 impact days. And we're just taking this break to welcome and acknowledge Dr. Sean Simmons, who serves as Alpha Kappa Alpha's International Impact Day coordinator. So we want to thank her for joining with us, and she's always supportive of our events and programming. And if you have anything you want to say, we'll give you some time to say something, Dr. Simmons.
Yeah, just really quickly, thank you very much for your ongoing support of Impact Days. It always is a pleasure to be able to pop into chapters to see all the creative programming. And of course, you all are no exception to that. I have really enjoyed the information so far. Again, thank you so much for these last 4 years of supporting Impact Days and the Excellence Administration. And like I said, I'm taking notes because I have teenagers and young adults, and this is all the information that I definitely want to share. So again, thank you all for your support. Thank you for allowing me to say hello and to greet you. And please carry on. This is great programming. Thank you very much.
Thank you. I'll turn it back over to you guys, Nicole.
So our next presenter is Mr. Lamar Vaughn. Lamar Vaughn is a mentor, a veteran of the United States Navy, a certified sports nutritionist, and a certified National Academy of Sports Medicine personal trainer with the passion to understanding human and food behavior. He obtained his Bachelor of Science in Business Administration to include courses focused on human anatomy. He will receive his Master of Science in Nutrition in May. Vaughn's passion for fitness started as a preteen and has continued throughout his adulthood. In 2015, his passionate journey led him to the bodybuilding stage. Through hard work, consistency, and fellowship, in 2018, he made his debut and became an IFBB professional bodybuilder. His fitness pursuits and quest for lifestyle knowledge did not stop there, but included powerlifting and cycling to be first aid, CPR, and AED certified. As an NASM certified personal trainer, Vaughn has focused his efforts on additional learnings, which included anatomy, physiology, and fitness basics. From years of experience, he has gained knowledge and specialized in diabetes, hypertension, nutritional conditioning, weight management, and healthy body composition through providing personalized nutrition and proper exercise programs. Furthermore, as part of his knowledge sharing, he has given numerous presentations on how critical nutrition, exercise, and supplementation is to our daily lives. When he is not in the gym, Vaughn enjoys listening to music, reading, and cooking. Beyond self-care, he has had the benefit of working with young adults through schools' mentorship programs and coaching youth football. Without further ado, please welcome Mr. Lamar Vaughn.
Thank you all for having me. I really appreciate this opportunity to present. We're going to get right into it. So for the most part, a little backstory about myself. I suffered from hypertension at the age of 23 years old and was on the verge of a heart attack. So when I was asked to do this presentation, it really hit home. And the two presenters before me actually touched base on a lot of key points that I was going to cover. You can go to the next slide. That I'm going to cover on this first slide, but we're going to get right into the prevention after that. So Dr. Asid, I hope I pronounced his name correctly. He mentioned the silent killer, hypertension. At one point, I was on all kind of medication, blood thinners, Losartan, just a list of things. At the age of 23, I was in the gym. He also mentioned, Serena Williams being this, great specimen that she is. But hypertension, high cholesterol, cardiovascular does not know any shape, size, form, or that sort. You can look the par, look perfect, and still have, some kind of illness or disease. Some of the ways that me personally that I corrected that was like he mentioned, was finding out my family's history. So that was important for me. So finding out that like my grandparents had hypertension, finding out that my mom suffered from diabetes and things of that sort. So learning your family history is definitely key. And heart disease is by far one of the highest killers in the United States. So we're gonna go right into prevention. So let's go to the next slide where we're gonna cover nutrition. So healthy habits, proper nutrition, healthy heights, physical activities, and do not smoke, as also was covered earlier. So how did I correct my nutrition? How did I correct my hypertension, excuse me. So now at the age of 36, I know I'm no longer on medication. So there's ways of doing that. You can count your macros. If you're not familiar with that, what that is, you can reach out and I'll explain that. You can track your calories. Studies have also shown that I'm going to talk about men and women. Men should only have two alcohol drinks a week, and women should have one a week. So that could be one way to correct it. Are you cooking your food? Or are you eating out? Are you baking your food? Are you frying your food? Are you grilling your food? So some of the healthy changes you can make is grilling or baking, and definitely cooking at home. So that was the first change I made personally to getting my blood pressure low, was cooking all my foods. As you mentioned in the beginning, that I enjoy cooking. So that was one way to correct it. When you're going out to these restaurants, picking, not letting your eyes be bigger than your stomach. I know some of you heard that term, not letting your eyes be bigger than your stomach. If you just had a meal at home, you don't need a full meal at the restaurant, and things of that sort. Some other changes you can do for proper nutrition is, I don't know if you've ever done it, but if you pick up, let's say a box of noodles at the grocery store, it'll have on the back of nutrition facts, it'll state based on a 2,000 calorie diet. So a lot of us don't do that. A lot of us don't monitor that, how many calories we're taking and how many calories we're exerting with energy. When I say exerting with energy, meaning are you exercising as well? So I'm big on looking at nutrition facts, for hypertension purposes. Sodium intake, do you know what's the proper sodium intake you should have per day? It should be under 2,300 milligrams a day. And some people may ask, how do you measure something like that? Well, there's a numerous amount of apps out there that you can use to track your food. One that I personally like to use is MyFitnessPal, and I've been using that consistently for like 5 years. Like, I've not broke a day. Like, my streak is like so many days in advance. So that's one way to track it. You can also measure your foods, find out the proper protein intake you should have daily, proper fats intake you should have in daily, proper carbohydrate intake daily. I know a lot of people are probably afraid of carbohydrates, but the body functions off carbohydrates. So anyone I've ever written a meal plan on, they may be like, oh, 200 milligrams of carbohydrates. I'm like, that's nothing. So I like to tell people to look up your favorite meal from one of your favorite fast food restaurants and look up the calorie intake, look at the protein, look at the fats, look at the carbs, and you'll see how much food you're actually taking. And most of the times you're taking in 2 or 3 meals in one setting when you eat at this fast food restaurant. So those are key things that can help you make those changes. Knowing the proper amount of water you should be drinking daily, which should be 70% of your body weight. A lot of people, not familiar with that. Are you taking, with supplementation, are you taking the proper multivitamins? Are you vitamin D deficient? Just like the presenter before me stated, getting your blood work done, knowing where your cholesterol is so you can lower that, like eating less high saturated foods, like for example, butter, cheese, and things of that sort. Not saying don't have it, but in moderation, coming from the background, coming from my family's from the South. So, they cook, they cook with butter, lard, all that stuff, and, we've just been ingesting it over the years and, just correcting those habits. And most importantly, are you getting your physical activity? For women, you should be, like Dr. Sita said earlier, you should be working out a little over 2 hours a week. So you don't have to work out every day like myself or some other people, but at least getting a brisk walk in 3 to 4 times a week, 20, 30 minutes. If you like to ride bike, do that. If you have, we have all these apps now and YouTube and things of sort, like just getting in your living room and being way more active. You can prevent heart disease, you can prevent hypertension, diabetes, and things of that sort. I've been blessed to have the ability, and God's given me that, to help people get off the medications, to help people, get off insulin. Like some people think they'll never be able to get off it, but there are studies that show that you can lower your insulin intake with proper monitoring of it and get off of it. So don't fall, I go to the doctor, but I'm not a fan of it, but don't fall victim to just what they tell you. There's ways to defeat all of it. And I'm walking testimony that I haven't been on medication for 13 years. So with that being said, we can wrap it up there. If you have any questions, please feel free to ask.
All right, thank you. We do have a few questions here. Do you recommend salt substitutions? And if so, which ones?
Honestly, so salt is not actually bad for you. It's just the amount of salt that we may take in. Like I said, most people don't measure the salt. So if you choose to use salt substitute, that's fine. I mean, I really don't recommend it because, like I said, you need some salt in your body. Have you ever like just cramped up or had a Charlie horse or something like that? That's because your salt intake was extremely low. So salt is not ideally bad for you. It's just, the amount. We don't know how much we're taking, and that can cause high blood pressure as well, hypertension. Great question.
All right, another question. What are the risks and benefits of taking pre-workout supplements?
That's a great question. So personally, I have my own pre-workout that I've created. So some of the risks associated with it is if you're caffeine sensitive, you may not be able to sleep. If you have hypertension and you're taking in, some of these pre-workouts have 500-600 milligrams of caffeine, it may make your blood pressure go through the roof. That's why it's important to read labels. So like when I created mine, I know that a lot of people are vitamin D deficient. So I have vitamin D in my pre-workout. Like the Bang drinks, they have 300 milligrams of caffeine. So I kept my caffeine at that level. So the key is to read labels and do your homework. Don't just buy something because someone told you to. And that's one of the issues with the fitness industry. We tend to just jump on fads and trends, but read labels, educate yourself on it before ingesting anything.
Okay. What are your thoughts on plant-based foods?
I think if it works for you, do it. I'm not against any diet. I'm not against any of them. I'm a firm believer, something works for everyone. So I know some people like plant-based, some people like, they want to do like the Atkins diets, things of that sort. If it works, do it. I'm not against any dieting style.
Okay. Here's another question on salt.
Yes.
Do you recommend black salt?
You can do black salt. Yes, definitely. I mean, the key is the makeup of the actual salt itself. So your body can ingest it just as well. So you're fine with black salt.
Okay. And then we have one on keto diet. Is a keto diet healthy?
So keto diet, I've known people that have had success with it, but the key is with that, you have to know if you're in the state of ketosis. So a lot of people will say, I'm doing a keto diet, and I'll ask them, do you have the strips? So what the strips require you is you have to use the bathroom on the strips, some urine on it to know you're in ketosis, because you can be thinking you're doing keto and you're really not. And for those who don't know what ketosis is, or keto is a high protein, high fat diet and literal to no carbohydrates. But what people fail to realize is that when you do like 0 to no carbohydrates, you still run the risk of gaining fat. For example, with a carbohydrate, if you have a proper plan, a proper nutrition plan, and your nutritionist is telling you to eat 200 grams of carbohydrates, your fats will be extremely low. But with that, if you're exerting the energy, you will exert the energy to burn off the carbohydrates, which also will burn off the fat. So that's just how the body works. The body only knows how to ingest and burn. So if you're ingesting too much fat, your body's gonna just soak it up. If you're not active, carbohydrates will also turn into fat. So, but the keto diet is just, you're gonna, 9 out of 10, you're gonna gain the weight back. Unless you're consistent, you continue to do it. And it's one of those things that can be a real fat diet. Like I said, I'm not against it, but just remind you, if you're not, it's not a 1 month and done thing with the keto thing. You will probably have to continue to do it.
Okay. I have another question here. Is there a real benefit of turmeric?
Studies have shown turmeric can help with inflammation. For men, it can help with prostate and things of that sort. So there are studies behind. I haven't really used it myself, but I know there are studies that show that it actually helps with some different things for men and women, but I'm not really familiar with all of them.
All right, and the best question probably here. It says, can you share the link for purchasing your pre-workout supplement?
Yes, it'll be on the next slide, I believe.
Okay. All right, let me check one more time to see if we have any other questions. I think that is the last question for you. So I'll thank you.
I thank you all, appreciate it.
It looks like its contact information is on the screen, and then I'll turn it back over to Nicole.
Okay, well, thank you so much for that, Mr. Vaughn. One goal I'm going to try to incorporate is to cook more and eat out less. I love going out to eat. But now we're going to switch gears, and it's time to have a little fun. I hope everyone has their creative juices flowing and have your running shoes on, because it's time for the scavenger hunt. So here are the rules. There will be a riddle on the next slide. You have to figure out the heart healthy riddle. The answer to that riddle is going to lead you to the item that you need to search for. You're going to come back with your item, type your answer in the chat, and show your item in your Zoom frame. The first person to type the answer and get their picture verified wins a prize. So here's an example. For the riddle, soft and plump, I'll be right here. Throughout your dreams, you'll keep me near. So the answer to the riddle is pillow. Whoever brings the pillow back, type the answer in the chat wins. So do not say the answer to the trivia out loud. Let's have some fun. Now I'll hand it off to Erin for our first trivia question.
Good afternoon, ladies, and I believe I saw a few gentlemen in the crowd as well. As Jeanette mentioned, hopefully you have on your running shoes. We're going to try and get your heart pumping a little bit while we run around and look for the items from these riddles. Some are straightforward. Some will require you to think a little bit, but I'm going to ask the DJ to crank up some music while we work through these riddles. But the first, which fruit loves a core workout? I see people typing it in, but you have to have it in the chat as well as show the picture or the item in the frame. So which fruit loves a core workout? Dear Margarita, if you can keep your eye on the chat to see who was first and who showed the image first. And Dear Margarita, if you could let us know once you have a winner. And so that you're aware, the prize for the winner will be a free nutrition consultation with Lamar himself. So we'll pause and let Margarita let us know who won. Again, if we could have some music from the DJ. If we could briefly stop sharing the slides so that we can make certain that your Margarita can see the images of everyone. I see a lot of apples. just got word back. It looks like our winner was Felicia Stiff. Yes, the answer was apple. It looks like Felicia typed it in and showed her apple first. So congratulations to Felicia. Felicia, I believe we have your information, but for our follow-up winners, if we can make certain that we get your name and email address in the chat so that we can get your prize to you. So again, congratulations, Felicia, for apples. All right, we're not done, guys. Next up, next slide, please. Which exercise did the trainer skip over? So let's think about it. Which exercise did the trainer skip over? You have to be the first to type it in and show the answer in your frame. Which exercise did the trainer skip over? Back to you, DJ.
Nah, I'm gonna interrupt this game because everybody typing and not showing stuff. You're supposed to go get it first and then type it in the chat. You don't give everybody the answer. It's a riddle.
And it's a competition.
Right.
All right, I see a lot of answers and a lot of pictures. Who did we get first? All right, it looks like the winner was Dana Irving. Congratulations, Dana. Yes, I think we figured out what the answer was already. It was in fact jump rope, but it was Dana who typed it in and showed the image first. Congratulations, Dana. And Dana, your prize as well is a free nutrition consultation with Mr. Lamar Bone. Woo! Woohoo! All right, we have a couple more, guys. This next one, before we show the question, oh, well, there it is. The prize for this one is a $25 Amazon gift card. So what should you do if you have a vegetable joke? You have to think a little bit more about this one. It's a phrase. Again, think riddle. What should you do if you have a vegetable joke? Got to think about this one. I think you got them stumped with this one, Jeanette. I see some wheels turning. What should you do? That's a good one. That's not it, but that's a good one, Lucretia. Lucretia said squash it. Nope, that's not it.
But does she have a squash in her hand? Does she have a squash in her hand?
So it wouldn't have mattered anyway, but yes, make sure you type in, have the item in your hand. What should you do if you have a vegetable joke? Oh, Mr. Margarita, do we have a winner? If we could close the frame so she can confirm.
Oh, sorry.
No winner yet? I think I saw the answer, but did that person not bring the picture to the frame? I gotta do both to win. All right, I'm not seeing any pictures. A lot of people are saying it, but we have to see the item as well. Get creative, print something out, draw it if you don't have it. We gotta have both. Oh, I see a picture.
Michelle has her cell phone up.
Who's that?
Michelle has her cell phone up with a picture on it.
Was Nichelle first? Because I see a few other pictures.
All right, we have Rosita with something in her hand.
Okay, it was confirmed. The first one for the answer and picture, does she have the picture, is Rosita Oliver. Did we see Rosita's picture as well? Okay, congratulations, Rosita, for your $25 Amazon gift card. All right, so we warmed up. I saw a lot of people running around. We have one final one, another $25 Amazon gift card. And the question is, next slide, please. Oh, well, we could show the answer. Sorry, the answer was let us know. So lettuce. But what did the grape say when it was crushed? Got to think about this one too. What did the grape say when it was crushed? I see some aha faces. I see wheels turning. Juice me. That's cute. Nope, that's not it though. All right. All right, I see some pictures. Who's our winner, Jamargarita? Did I miss your response? All right, you know what? We had a winner who already won, so we're gonna go with the next one up. All right, we're gonna give Jamargarita a second to figure out who that second person was with the answer and the item. Sorry, Andronique, we need the actual, it has to be it. Andronique says she only has a glass. Is it full? That's the question. All right, who do we have? Who's our winner? If I missed it, Jamargarita, feel free to come off mute and tell me, but I haven't seen it. Okay, she's still looking. I may need to have y'all type the names of these bottles you're holding. I may have to find some of these. They look good. Try not to stress you out, Margarita. Everybody had this one too close by. I'm beginning to wonder, were we sipping on this while we were watching the presentation? If it was red, I guess that's good for heart health, but. All right. We have tons of bottles out there, Jamargarita. Yep, red wine is good for the heart. Did we find them, Jamargarita? All right, we had some committee members help us out, Jamargarita. It looks like the winner was Nichelle Everett. Oh, sorry, Nichelle, all right, the first person, apologies, Nichelle, but I have bottles at my house, I'll share. But the first person was Stacy Kudor. Is Stacy here? The winner was Stacy Kudor. The response was nothing, it just let out a little whine. So wine was the answer. Congratulations to Stacy Kudor for another $25 Amazon gift card. Thank you guys so much for taking the time out to run around for this scavenger hunt. Hopefully that got your heart moving because I see Tracy ready to work y'all out. Thanks, guys.
Wow, what a fun break. That was fun, huh? I too need to get some of those wines. Drop it in the chat. All right, so now it is time to work. We are here to work. I hope you got your shoes on and you're ready to sweat it out, because one thing we know is exercise is key to heart health. And yep, we're gonna work it out, and we're gonna help everybody today with this workout from Tracy. We are pleased to have Tracy Robinson do our trap Zumba to help us work this out a little bit today. Tracy is a thriving fitness instructor and personal trainer in the Houston area, whether moving or dancing on the floor in her Zumba classes or providing the footwork in extreme hip hop. Tracy is also known for bringing us the energy. Also centering around balanced nutrition and total fitness as her objectives, Tracy has vigorously assisted her clients in achieving in their health goals and objectives. Tracy has a phenomenal story. She's lost 100 pounds plus with naturally weight loss, and that's huge. And she has been a driving force in motivating others while on her personal health journey. So with Tracy's infectious energy, she's gonna leave us enthused and ready to conquer the world. So Tracy, take it away. We are excited to have you. And let's get up, everybody. Let's get to moving. I think we need to share Tracy's page.
There we go. Hello, hello. Okay, I am so excited and elated to be here again this year. You kind of heard my a little bit. Yes, I lost 100 pounds, all natural. As Mr. Vaughn stated before me, gave great information before me. In my 20s, my blood pressure was sky high. I went to the doctor, blood pressure was in the 200s. And I just decided when I got in my 30s, I needed to do something about it. So I was diagnosed with hypertension as well as type 2 diabetes. I am managing my diabetes with food and nutrition and exercise. So I no longer take any medicine and I no longer take any hypertension medicine. So it can be done with diet and nutrition. We're gonna do a little workout today. I'll take you through a warm up. We'll build it up and then we'll bring it back down. So turn your cameras on. Please make sure that your devices are on mute so that you'll have the best audio experience. And let's get going. I'll kind of go over the moves, but I think that you can get it because they're really simple. I always say your exercise should be fun. So make sure that you do something that you enjoy doing. I love to dance, so that's my cardio most of the time. 5, 4, here we go. 3, 2, 1. Let's go. Tap, tap. Let's reach. Push. Come on, let's go, let's go. Whoop, whoop. Hey. Let's take it. Tap, tap. Let's reach. Come on. You got it. Let's go. Great. Step touch. Grapevine. Step touch. Let's do it again. Step touch. Okay. Come on. Hamstring. Single. Double. Let's go. Single. Double. You got it. Okay. Come on. Hips. Shake. Hey. Come on. Have fun with it. And I can have it. Count it out. 4, 3, 2, 1. Let's go. Okay. Reach it up. Whoop, whoop. Come on. Take it real low. Okay. Let's go. Reach up. Whoop, whoop. Come on. Grapevine. Step touch. Grapevine. Step touch. Do it again. Let's go. Let's go. Hips. Let's shake it. Oh. I know you're so good. 3, 2, 1. Push. Woo-hoo. And reach. Take it. Go. Come on. And push. Reach it. Let's go. Let's work those hips. Single. 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 Wait. Come on. Push. 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 Hey. Come on. Jump up. Let's go. Let's go. Push. Take it up. ladies and gentlemen. Let's move it on. Y'all are doing awesome. Here we go. We're building. That was the warm up. Yes, that was the warm up. Let's go. I like the music. Hey, we're gonna punch it up and down. Let's go. Up, down, down. Let's switch it up. Up. Let's go. Come on. Now switch it up. I bet you want. I bet you want. Come on. Switch it up. What? Let's go. To the front. Jab. Hook it out. Hook. Let's jab. Jab. Hook. Uppercut. Hit it. Come on. Keep it going. Yeah. Looking good. Let's go. Hey, get it. Get it. Let's go. Squat. 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 Now, good morning. Chest over. Hinge it over. Hinge. Hinge. Keep that core tight. Let's go. Here we go. Squat pose. Hey. Keep it low. Keep it low. Keep it low. Keep it low. Hey. Punch it up. 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 Now switch it up. I bet you won't. I bet you won't. Come on. Now switch it up. Come on. Get it. Get it. Switch it up. Hey. Hey. Jab it. Jab. Hook it out. 4, 3. Jab it out. Jab. Hook. Uppercut. Let's go. Come on. Turn that knee in. That's where your power comes from. Hey. 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 Squat, clap, clap. Squat, clap, clap. Clap, clap. Hey. Good morning. Good morning. Good morning. Good morning. Good morning. Come on. Hey. I bet you won't. I bet you won't. Now switch. I bet you won't. I bet you won't. Switch. Let's go. Let's go. Switch. Hey. 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 Jab it. Hook it out. Jab. Hook it out. One uppercut. Hit it. Boom. Yes, y'all are looking amazing. Amazing. Here we go. We're going to keep it moving. If you don't know a move, the best thing to do is just hit that 2-step. If you can't pick it up, you just keep moving. Water break. We get water. This is only like a 25, 26, 27-minute workout. You don't need water yet unless you need water. You don't need water unless you need water. Let's go. Look amazing. Here we go. We're going to slow it down. I'm going to let you catch your breath a little bit. Hey. Let's go. 1, 2. 1, 2, 3. 1, 2, 3. 1, 2, 3. Hey. 1, 2, 3. 1, 2, 3. Right here. Clap step. 1, 2, 3. Clap, clap. Roll. Clap step. Clap step. 1, 2, 3. Clap, clap. Clap, clap. Roll. Hey, let's go. Come on. Clap, clap. All right, we roll. Move it. Move. Ha, ha. Let's go. Left leg. Bring it up. Left leg. Take it back. Step. You give me more than sugar. Come on. Clap. Clap, step. Clap, clap. Roll your body. Hey, hey. Clap, step. Clap, clap. Roll your body. Body roll. Move. Move. Hey, hey. Left leg, come on, you got it now. Bring it up. Left leg. Take it back. Let's move. 1, 2. Come on. Yeah. Clap, clap. Hey. Clap, clap. Throw your ball. Let's go. Do it again. Clap, step. Y'all look good. Clap, clap. Yes. Amazing. Amazing. Grab water if you need it. Towel off if you need it. Here we go. Y'all are doing amazing. If you are new to working out, listen to your body. If you are new to working out, listen to your body. Keep moving. Move your feet. All right, we're going to take it back up. In my class on Saturday mornings, there's a group of ladies, and I always tell them to split the room. The reason why we split the room is because I want them to look at each other and to encourage each other when I turn the song on. It's important when you work out to have a community, a group of people that's going to push you, because sometimes you don't feel like it. But it has to be more than about what you feel like doing, but what you need to do. And sometimes you need that person to encourage you. All right, so I'm gonna turn it on. If you see one of your friends on the camera and they look a little tired, send them a text. Encourage them, girl, you got this. You can do this. Somebody's typing in the chat, it's only 2 minutes. Just type it in the chat for me. It's only 2 minutes. Listen, on this song, you can go as hard as you want to. You can keep it low, but I want you to promise me one thing. You won't stop moving your feet. Thank y'all. It's only 2 minutes. It's only 2 minutes. Promise me that you won't stop moving your feet. You can move them little, or you can get your knees all the way to your ceiling. Just don't stop. All right, here we go. Y'all got this. This is one of my favorite songs. All right, y'all ready? 3, 2, 1, let's go. Come on. Let's go. Run it. Push it up. Push. 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 Come on. Take a step down. Push. Push. Come on, you got it. You got it. Let's go. Y'all ready? Come on. Are you ready? Let me see you. Yes! Give yourself a hand. Yes. Go, y'all, go. I like it. Somebody said, woo, child. You tired, that's all right. It's okay to be tired. You're getting it done. I always tell my ladies, you are doing something for yourself. Y'all better work. Here we go. I'm gonna let you catch your breath. Let's get it. Right hand is up. You want to squeeze outside. Here we go. Knee pulling. Stick. Stick. Squeeze it. Shake.
I can't even pass on. She walk around with all that.
Pull it. Pull it. Squeeze.
Dig. Dig. I can't even pass on.
Go ahead.
She walk around with all that.
Drop it low. Squat.
Best deal.
Squat.
Let's free.
Squat.
Last mile. I'm like,
Hold it. Open it out.
from Miami.
Take it right in out. Right. Take it down and up. We got down. Down. Hold it out. Take it right in out. Hey. Now bring it to the front. Right. Left. Lunge it. Right. Left. Right. Left. Now back it on up. Right. Left. Right. Lunge it. Here we go. Pull it. Pull it. Come on. Knee up. Take it.
I can't even pass on. She
Go.
walk around with all that.
On the side. Squeeze. Squeeze.
I can't even pass on. She walk around with all that.
Drop it. Squat. Sit back on those heels. Hold it.
Good girl.
Take it right and left. Oh. Down and up. Down. 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 Hold it. Take it right and left. Yep. To the front. Right. Left. Right. And lunge it. Hey. Hey. Now back it on up. Right. Left. Right. Lunge it.
Yeah, I can't even lie to you. She told me kid, ain't fine.
Let's go.
Yeah.
Pull. Pull.
I can't even pass on her. She walk around with all that.
Other side. Pull it.
I can't even pass on her. She walk around with all that.
Last time, drop it. Drop it. Drop it. Hold it. Take it right and left. Boom. Down and up. Down. 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 Hold it. Hey. Right and left. Hey. Y'all are doing an amazing job. I hope you feel like it because you're doing great. Grab water if you need it. Grab water. Step up. Come on. We bring you back down. Come on. Rock it up. Hey, boy. What you say? You trying to play boy? Like a game boy. Is you on boy? Are you on boy? Could be on boy. A boy on the street. A boy on the street. See a man on the streets. It's all great to me. That's the voice of his face. That's right. Baby, I don't mean. Roll it back. Roll. Left leg. Hey. Roll it back. What? What's 2 + 2? Here. Come on. Now roll it. Here. Here. Out the side. Up, down. Up, down. Roll it. Walk it out. Like big kill. Itty bitty boys. Mississippi boys. Mississippi boys. Like a bitty boy. With the boots. Get your nails in. Bring it out. I like a bitty. I like a bitty. I know the super names. Come in, bitch. From the playboys to the gay boys. Go on, playboys. Left leg. Baby, I don't mean. Roll it back. Roll. Hey, left leg, right leg. Roll it back. What's 2 + 2? Come on. Roll those hips. Out. Out the side. Come on. Roll your hips. Now we're gonna break it down. Just like this. Right left. Head. Right. Head. Do it again. Right. Head. Up. Go. Let's go. Come on. Come on. Flip it out. Woo. Roll your hips. Outside. What? Left leg. Roll back. Left leg, right leg. Roll it back. Break down. Yes. Okay. This is what we're gonna do next. We're gonna cool it down. All right. In this part of my class, I always call it the boss walk. A boss does not mean that you're an entrepreneur. A boss simply means that you are taking the step that you need to be a boss in your own life. You need to do 3 things. Remember 3 A's. The first one is to be authentic. Be real with yourself. What are some things that you like? What are some things that you don't like? And how can you change those things? The second one is just to be awesome, because I believe that God created us all to be awesome. And the third one is just to be audacious. Have the audacity to do what it is in your health walk, in your faith walk, in your financial walk, whatever it is that you know that you're being told to do, have the audacity to do those things. And our fitness is a big part of that, all right? So we're gonna cool it down. I call this the boss walk, and you're gonna love this song, I guarantee you. Let's get it. Y'all did amazing today. I am so proud of you for moving your bodies. You know,
Step it out.
he gets scared. And self-doubt clouds your confidence. Stand in the mirror
Walk it up,
and say this. I'm capable of winning. Come humble.
Back it up.
Beginning. And it doesn't matter what I've been. Success is in my reach. If I can tell the truth and do it,
Back it up. Stretch it out. Slow. Go ahead. Roll to your knees. Walk into the middle. Hold it. Walk it over to your left. Go ahead. Roll to the knees. Hands back to the middle. Walk your feet in. Walk. Walk. Roll it up. That is the last thing. Shoulders. Roll it. Roll it. Roll it. Roll it. Roll it. Roll it. Shoulders to the front. Roll. Play this. Yes, I can make it. Come on. Come on. Right on. Wash your body. Hey. Hey. Left arm. Wash your body. Hey. Walk it up. Yes. Walk it back. Hip. Deep breath in.
See, you good, girl. You got this. And there's nothing that you cannot do. You're strong and you're so
One
smart.
more deep breath
You
in.
are born great. Everything you touch turns gold. But you gotta believe that even when you don't understand the process.
Now listen, take both hands out, wrap them across your body, and give yourself a big old hug for doing something for yourself. Great job, everyone, and thank you so much again for working out with me today. The last song, I'll put it in the chat. Good job, ladies and gentlemen. Great, great job.
Awesome job, Tracy. Thank you so much.
Thank you so much.
All right, ladies, great job. We'll move on with the rest of the program.
All right, that was such an awesome workout. I just want to thank Sora Tracy so much. I am a little bit out of breath. While we're hydrating, we have some very cool door prizes. Everyone who registered before today was placed on our prize wheel. So we will spin the wheel to see who wins. We have several door prizes. We have 2 $25 Amazon gift cards, and we have 2 healthy cookbooks entitled The Full Plate by Aisha Curry. Remember, winners have to be present, so make sure to speak up if your name is called, and then put your first and last name along with your email address in the chat. So I'm going to go ahead and I'm going to share my screen so that I can get the wheel up. All right, so this is going to be for the first $25 Amazon gift card. Rhonda Dallas, are you here? I cannot see it. All right. All right. So this next one, this is going to be for our other $25 gift card. Is Stephanie Wilson here?
She's not, Charmaine, she's not here.
Okay, we'll go ahead and we'll spin the wheel again.
Nikisha is here.
All right, so just make sure to put your first and last name and email in the chat. All right, our next prize is going to be for the cookbook by Aisha Curry.
I don't see Epiphany in the audience today.
Okay, so we'll go ahead and we'll spin the wheel again.
Four times a month, if that.
Tyra is here today.
He's here.
Okay, just make sure to drop your first and last name and your email in the chat. And this final spin is going to be for our last cookbook by Aisha Curry.
Fatima is present.
All right, just make sure to drop your first and last name and email in the chat. All right. All right, thank you guys for being so engaged during today's event. There were a lot of wonderful speakers and also the trap. I know a lot of us are tired. I just want to take one final time to remind you that your feedback is very important to us. So before we conclude, please take out your phones and you can scan the QR code that's popping up on the screen to complete our event survey. Also, the link will be dropped in the chat for convenience. So we highly recommend that you guys do the feedback so that we will know how the event went for you. At this time, I will go ahead and I will turn it over to our Basilisk for any closing remarks.
Hello again, everyone. My name is Raquel Garrett, and I serve as the president of Chi Omicron Omega chapter. We're always excited to bring our community valuable information. I hope everyone was not just logged in, but really paying attention to the information provided and have identified at least 3 changes that you can make in your life and your family's life to make you and your family healthier. And that's part of our legacy to our families as well as our health. I have a family history, just like most African Americans, of many conditions that put me at risk. And because I made a point to try to be more healthy in my life through exercise and changing some of my diet, I am probably one of 5 members in my family that are not on any type of medication, even though we have a huge history of hypertension and things like that. But because I made choices in my life to change some things, again, diet and exercise, I don't take any medication, even though some of my family members started in their 20s with high blood pressure medication. So I just encourage you to make a choice to take your health seriously for longevity and make some changes. I want to thank Target 2, Dr. Nicole Plenty and Jeanette Smith, along with the other members of the Target 2 Women's Health Committee for putting this on. I think this was great information. And I will say, for those of you who do hookah, reevaluate hookah, because a lot of times the things they put in our community is intended to cause problems. So be careful of what's dropped in our community. and is not everywhere else. But I do want to thank everyone for the information and all of the presenters that was here today. And I'll turn it over to our Vice President, Kimberly Etheridge, if she has anything. Thank you for attending, everyone.
Good afternoon, everyone. My name is Kimberly Etheridge, and thank you, Raquel. I serve as the first Vice President and Program Chairman for Chi Omicron Omega chapter of Alpha Kappa Alpha Sorority Incorporated. Today's event is our chapter's observance of Alpha Kappa Alpha's International Community Impact Day. Additionally, Chi Omicron Omega will partner with Phenomenal Pearls Educational and Charitable Foundation to make a monetary donation to the Black Heart Association. Wonderful job to our Target 2 Women's Health and Wellness Event Subcommittee led by the Target 2 Chairman, Dr. Nicole Plenty and Jeanette Smith. We have received great information to help us lead healthier lifestyles this afternoon. Women can lower their heart disease risk by as much as 82% by just living a healthy lifestyle. We want to know our numbers and hashtag no diabetes by heart. As well, since adults with diabetes are more likely to have a heart attack or stroke than those without diabetes. The American Diabetes Association and American Heart Association have an initiative, No Diabetes by Heart, with a goal to empower those living with type 2 diabetes to be aware of and lower their risk for cardiovascular disease. To our esteemed speakers and presenters, Dr. Adeshino, Ms. Hennigan, Mr. Vaughn, and Mrs. Robinson, thank you for sharing your afternoon with us and providing us with ways to make strides to protect ourselves and our futures. Finally, thank you all for attending our event today. Please remember to provide us your feedback in the survey. If we could drop that back in the chat one more time. Also, continue to follow us on social media. This month, we will continue to share helpful tips for heart health. Today's event has been live streamed on Facebook, and it will be available for you to go back and review or to also share with others. Thank you again, everyone, and have a safe and wonderful afternoon.
And Tracy also dropped her link if you want to follow Tracy on Instagram for her Trap Zumba.